My name is Daphne Broadhurst. I'm a clinical nurse specialist with Infusion Excellence Consulting. Welcome back to part 2 of this video series. In part 1, we looked at how to teach your patient to self-administer home IV antibiotics in just one visit. In part 2, I'm now going to review some additional strategies for you to be an awesome patient educator when teaching your patients. Explain at a high level what the patient is going to learn. For instance, how to keep things clean, how to flush their IV, and how to hook up and disconnect, how to get their supplies, how to watch for problems, and who to call for help. Please assess the patient's learning style before you start your teaching so that you can adjust your teaching method accordingly. Don't assume that everyone is an auditory learner, that they learn just by listening to you. If they prefer using a manual, if they're a reader-writer, make sure you use the written patient education material, following along in the manual as you teach. If they prefer listening, suggest that they can watch the video. If they're a hands-on learner, let them handle the syringe as you're showing them. So Scott, tell me something. When you get something new, how do you like to learn how to use it? Do you prefer to read instructions? Do you like to watch a video? Do you prefer to have somebody tell you how to do it? Or do you prefer perhaps to just pick it up and figure it out on your own?
I like to read instructions. Okay,
so when you're learning how to do that, I want you to follow along in the book and we'll follow the instructions. So you're going to, first thing you need to do, it's also really helpful if you remember to use current patient education materials that you tailor or personalize to the patient. You can underscore, highlight, write notes for that patient. Use multimedia. Incorporate verbal teaching, demonstration, return demonstration, print material, and video. These will all reinforce the learning. Now, while I'm doing my charting, what I'm going to suggest to you is that perhaps you can watch the video because you like to read. We do have a video. If I'm not here and you forget what you need to do next, you'll have your instructions, but we do have a YouTube video. So you can just turn the video on. So I'm going to get you to just quickly go over it right now, have a view of the YouTube video while I'm doing my charting, and then we can look at if you have any questions. Okay? A critical component of health teaching is to use plain language. Keep it simple. Use non-medical short words of 1 or 2 syllables. Use short sentences that are in the active tense. Your patient may be stressed, they're likely unwell, and having to learn a new skill is stressful. So keep it simple for them. Studies have shown that it's not insulting to use plain language. As nurses, we may not be familiar that we're using medical terminology that the patients may not understand. So I encourage you to look at this table on your screen and try to adjust your language using these plain language terms that the nurses in the studies use frequently to try and enhance the patient learning experience. And now we'll take a look at an example of what to avoid when teaching a patient, followed by a second example which demonstrates the correct teaching principles. Flush the catheter with a saline syringe to make sure it's patent.
Sorry, what was that?
Oh, you know what, you're right. Let me try that again because I don't think I explained that well enough and probably a little too much information. So let's try that again. Now you've just killed most of the germs on the end of your IV. So now you need to check your IV to make sure that it's working well. So you're going to push the air out of the syringe, first by twisting it open, and then you push and twist. And then make sure your clamp is open, and then you squirt, squirt, squirt. And that keeps the inside of your IV clean. Now let's review. What plain language terms did I use in some of the previous clips to explain, for instance, hub disinfection and flushing to maintain patency? What word would you use for disinfect? syringe, plunger. How about turbulent flush? Occlusion is a 3-syllable, more formal word. How about antibiotic? That's 4 syllables. Another strategy is to make sure you break the tasks down into bite-sized pieces. Use small chunks. Teach one step at a time. This prevents overwhelming the patient with too much information, and it gives you the opportunity to validate your teaching at each step. When you break steps down into small chunks, you need to check for understanding at the end of each chunk before moving on to a new concept. Remember the term chunk and check. In the previous video clip, I broke down each task into small chunks and then validated my teaching, providing feedback after each chunk. It's especially important to validate verbal teaching, as your patient can't validate their learning through a return demonstration. So Scott, I've just explained some of the complications that you can run into. Do you have any questions?
No, not at all.
So what was wrong with the dialogue in this clip? Did I really validate that I explained this well and that the patient understood? Not really. By simply asking, do you have any questions? I really don't know if I taught them well. Using questions such as, any questions? Do you understand? Will likely not elicit any validation of that teaching. With teachback, you need to validate your teaching. Ask the patient to explain back in their own words what they understood. For instance, you can say, we've gone over a lot of information. In your own words, can you explain to me what we talked about? Now let's look at some examples of teachback that would elicit a better understanding of my patient's learning. Scott, we just went over some of the problems that you might run into, and I want to make sure that I explained everything clearly. Can you tell me what you and your wife would do if you developed a fever?
Well, fever could be a sign of infection, so I think I'd go to the emergency.
Excellent. I'm glad that you recognized that fever could be a sign of an infection. And there's a few other things that you could do if you have a fever. What else would you do?
Not sure.
Well, what you would do is you would check your brochure. So you're going to open the instructions to help guide you when you have a problem. So in looking at it now, what might you do if you have a fever?
It says here I could call my nurse.
Excellent. So let's circle that so that if you have a problem, you know that you have your brochure that you can refer to if you have a problem. And don't forget, your nurse is another resource. She's just a phone call away, so you can always call the nurse's office at this number here if you have a problem. You saw what happened when I used the open-ended question, asking the patient to explain his understanding. By using an open-ended question, I discovered that the patient didn't really understand what I had just explained. Another important principle of teachback is to reteach if that teachback wasn't correct. Make sure you don't simply repeat in the same way what you just taught them. If they didn't understand the first time, you need to switch it up a bit and try teaching it slightly different to optimize their learning. Another principle when you correct patients is to avoid using negative terms or shaming the patient. Try not to say, don't do that. I encourage you to first sandwich the critique with praise. Start with acknowledging what they did right, praising their activity. For instance, in the last clip, I started by praising Scott's recognition of the signs of a fever. Then reteach. For Scott, I cued him to use the brochure to reinforce later use of that patient education material and use positive phrases. Do this rather than saying, don't do that. Then, of course, reassess what you just re-explained. And then finish the sandwich with praise. I positively reinforced his learning by saying excellent, for instance. Another tip that I use frequently when teaching someone is to encourage problem solving. If the patient runs into a problem or for gets a step, don't admonish the patient, and rather than just describing what they did incorrectly, so for instance, you forgot to scrub the hub, encourage the patient first to figure out what went wrong or what they missed. You're not going to be in their home watching over their shoulder when they're self-administering. They have to learn how to identify problems and troubleshoot accordingly. So instead, encourage problem solving. Ask them questions so that they can figure out what went wrong and how to fix it. Let's look at an example of this. So Scott, you did a great job pushing the air out of this syringe. Now, before you attach your flush to your IV, what do you need to do?
Not sure.
Well, let's look at your IV cap. It was probably touching your clothes and the dirty table. What might be on the end of that cap?
Probably some germs.
Excellent, that's right. I mean, if you screw your flush onto your cap, where are those germs going to go?
Just right into my IV tube.
That's right. So you don't want germs in your body. So Scott, what can you do to get that clean?
Not sure. Oh, of course, scrub the hub.
Excellent. So you recognize that the problem is that could be dirty and that you always have to clean it before you attach your flush. Okay, so go ahead. In this clip, I prompted the patient to figure out what the problem was. In this case, the lack of disinfection of the cap. But I also asked questions to help cue him to the solution. Rather than telling the patient to scrub the hub, I gave him a visual cue or a prompt, sliding the alcohol swab forward or tapping it. You're providing a visual cue, and then the patient has an aha moment by saying, of course, I have to scrub the hub, and they're more likely to remember that the next time. Now let's check in. When you use Teach Back, hopefully you're asking the patient to explain the material back in their own words so that you can evaluate your teaching and their understanding. And rephrase if they didn't understand the first time. Make sure you don't use the same phrases as they didn't understand it the first time. And then recheck their understanding with this new explanation. Lastly, encourage problem solving, ask questions, use prompting and cueing so the patient can come to their own recognition of what the problem is and then problem solve to resolve that problem. Now, in some of these clips, what key elements of effective teach back did you observe the nurse using? Hopefully they adjusted their teaching to the patient's learning style, whether there's a reader-writer or a learner or a hands-on learner. You set the learning goals at the beginning of the visit. You use plain language, teaching in small chunks and asking the patient to explain back what they just learned in their own words. And then if they weren't correct, you explained it again and rechecked for their understanding. And throughout the visit, you give plenty of positive reinforcement. Make this a positive learning experience. If you do have to provide any criticism, constructive criticism, sandwich that critique with praise. Encourage problem solving so that they can figure out what went wrong and how to fix it. And use prompting or cueing if necessary. Remember, personalize your patient education material and use that material. And then, of course, document the teaching and the learning progress. In summary, we've given you hopefully some tools to be competent, caring nurses who engage patients with the support of patient educational material and easy-to-use supplies to self-administer their IV therapy. We're confident that if you apply some of these principles of adult learning, you'll help trigger your patient's sense of skill mastery and autonomy, leading to outcomes such as patient and provider satisfaction, patient well-being, and improve healthcare resource utilization. With the use of these tools and always using Teach Back in your well-organized visit plan, you can effectively teach many of your patients in one visit how to self-administer. In the words of one of the study patients who mastered self-administration, they said, learning was pretty easy. Another said, it gave me the chance to do it whenever I had time. I didn't have time to run to the clinic all the time. And self-care was perfect for me. I'd like to thank Formative Pharma for their educational grant to support the development of this video. Hopefully you've gleaned some tips in how to be an awesome patient educator so that your patient can be an active and safe participant in their own care.